we know very well that there is a big range of costing for the drug development is available in the literature. As per the cost analysis done by British Pharmaceutical Industry, the cost come out to be 1.2 billion pounds. Then there is a Tufts report which has appeared in in 2016. The cost of the drug development is around 2.6 billion, which is like 3 times more than it was estimated in 2003. A very recent report in JAMA tells about that the development cost of a anti-cancer drug is around $750 million. Now, when we talked and discussed with Zydus, who has developed a new drug, Lepaglyn, that their cost is around $250 million. So, and when we discussed, like it was asked to in the last panel discussion, like Dr. Nityanand was being asked that what was the cost of development of Sencoman. And if you see that 13 drugs which came out during those periods, it is very, very difficult and challenging to really predict the cost of one drug. But we know that it was quite cheap to develop or to bring discovery as well as development, preclinical development, and even the clinical trials. They were quite cheap, and with that gives you a confidence, because CDRI has brought drugs to and licensed to the companies at a very, very cheaper cost. And at that time, the leadership was thinking that it is very important that our molecules should reach to the masses, rather than thinking of a business model around that licensing. And this is again, we are deliberating whether that is how much it is necessary, and whether our preference should be to bring the drug to the masses, or we do it a business model. So I personally feel that whatever research we should do, we are doing or we should do, should reach to the masses. This is very, very important. And when we are thinking of discovery, it is actually the total cost of this development comes out to be only 20%. So, although like there is an exorbitant increase in the estimated cost from 500 million to now 2.6 billion, and this is happening because the clinical trials are costing a lot. Now, there is another scenario which is emerging, that new drug discovery programs in many companies is actually closing. The recent one is in Lupin. So, there are two good market players like Zydus. They are sitting here in the audience, and also from Spark, like Mr. Anil Raghavan was here in the last panel, who are interested, and CDRI is having active discussion with these people to actually do some joint discovery programs. One thing which again bothers me, that why we are always thinking of US or West market. Why are we not thinking of our own Indian market for drugs to be introduced as well as are required? Because in last panel discussion, again, there was a discussion about affordability of the drug for and by the Indian, because we know that we need affordable healthcare. And there, with this idea, like CDRI had a very active program on around repurposing of the drugs. And we have at least 4 or 5 molecules which are showing very good activity in the preclinical models. And now we need them to test by conducting clinical trials. We have been talking to many, many pharma companies, even US-based companies we have talked about. Initially, they showed a lot of interest, but then ultimately, because it is not a business activity, nobody is coming forward for the clinical development or for testing these molecules by conducting clinical trials. So these are the dilemmas which are actually in my mind, and I hope that our panelists will address some of them. So I ask Amit for inviting our panelists, and then.
Sure. Dr. D.Y. Rao is indignant that he was not in the previous session, but I think it is equally important. And since I point out that the previous session too was ultimately about the costs and fundings of technology transfer, sir, maybe have your views on both technology transfer and the cost involved.
Thank you. Let me first at the outset thank CDRI for giving me this opportunity to come and present my views. When I saw the program, I have been positioned in this particular panel. I was just wondered why they have put me into this particular panel. Because my experience, everything is in technology transfer. Almost about 3 decades I have been involved in technology transfer and developing and evolving several of the policies of the CSIR, which today are developed during my period and during my time. Then I said, okay, like a jack of all trades, I will fit into anywhere, so there should not be a problem. I will be able to address that issue also. So I accepted it. Before I start my actual, what I wanted to say, they made my job very simple by saying that if you can talk about the PPP programs or the public-private partnership, how it got evolved in this country, they said that would be your topic. So I am very happy about it, since I have been involved in developing some of the things. So I thought it would be very good. So before I talk about the PPP, how it got evolved in the country and other things, I wanted to make only 2 points, clarifications basically. When they introduced me as that I am head of the Technology Networking and Business Development Division of CSIR, I am no more. I am just simply a superannuated scientist. I still help CSIR, but I don't hold any position in CSIR. The second most important.
So I would like to intervene here. A CSIR person always remain a CSIR person.
That's fine, but not as in the position, in the sense you can, a farmer retired. Okay. The second point, in the last session, one of the panelists has mentioned that we should have the policies which would permit the industry scientists to come and work in our laboratories, and our scientists go and work in the industry laboratories. Now, I must tell you, and the second point that has come is that industry working in CSIR laboratories in a what I would call in a specific program. I must tell you, these 2 policies which are already there within the CSIR system. The first policy we call is mobility of the scientists. This permits the scientists from CSIR system to go to industry for a specified period up to 2 years, and the industry people can come to CSIR and work in CSIR. The scheme is already in place. It's a question of laboratories to understand it and use that particular scheme. As far as the industry working in CSIR labs are concerned, there is also a scheme available, what we call is Knowledge Alliance. Now you can take a particular program and create a knowledge alliance with the laboratory. So they provide you the space and the people and the infrastructure. So you can start working for this thing. This scheme is also available within the CSIR system. I think these are there are a lot of schemes which are there in the CSIR system, and unfortunately many of the scientists do not know what all there, because this is the one which is dealt by the business development group, and their job is to communicate to all the scientists, these are the schemes that are available, or facilitate those things. I think I must tell one more thing is that CSIR is a very flexible organization. In transferring the technologies and other things, we are not very rigid. I think that's where I think CSIR comes. The ease of doing business and other things depends upon person to person. In a particular lab, the business development head may be, very fussy about doing the things. In some other places, the same person will do very fast. So it's a question of person to person variation, but otherwise the rules the guidelines have served the organization very well, and a lot of industry also, when they interact with us, they feel your guidelines are very transparent and very nice, and we have no issues with that particular thing. Even in the agreements also, we have a lot of flexibility. So having said those 2 important points, my association with the public-private partnership, what I call is PPP, started way back in 1993. That was the first time that we developed a program called Drugs and Pharmaceutical Research, DPRP. And there was a story about it, how it has started, what it was started. The first grant that has been given to us is 10 crore rupees. Every year they said 10 crore rupees we will give you. This we in the 1993 when we started, believe me, not even one industry has a new drug discovery laboratory. The first company that has announced that they are going to set up a new drug discovery was Dr. Reddy's Research Foundation, DRF. Then came the Ranbaxy. Ranbaxy said that we will get into the new drug discovery. They called it NDDR or NDDL, I don't remember now. New Drug Discovery Research, NDDR. So these are the only two which has announced, but before that only we started the program. The program was basically aimed at drug development. Now the scheme, the way we have developed the scheme was very interesting. That what we said was an industry can interact with an academic institution, including the research laboratories of CSIR or any other laboratories. Now you cost the project in such a way that you do the part of the work and the institute does the part of the work. And the part of the work that the institution has to, the total part that what the institute cost is, 70% of the recurring cost would be provided by the scheme. 30% has to be paid by the industry to the institute, whereas the capital cost of the institute will be borne by the scheme. So that means if you totally look at it, the actually industry outgo is going to be very small. Why did we do this particular thing? Actually, we wanted the total in the, both the recurring and this thing also to be met by this thing. But at that time, the secretary of the department said, no, let us not put the burden on the capital burden on the industry. So we will make it only 30% of the recurring. And we have done this particular thing up to 2000. I was the backbone of the particular scheme, and we have developed a large number of projects, whether it is Ranbaxy, whether it is drugs and Dr. Reddy's laboratories, Lupin, and even Dabur Research Foundation and many other companies. We have developed a large number of projects, and they are all for the new drug discovery and new drug development. But what happened somewhere around 2000 or maybe a little later than 2000, the enthusiasm of industry really get into the new discovery has slowly dissipated and it has become almost negligible. That's why you will find Dr. Reddy's have closed their DRF. Ranbaxy has disappeared from the scene. Even Lupin, as per her, this thing is that Lupin is also closing their this thing. And Dabur has also closed their R&D as far as this particular thing is concerned. Many of these people have closed their new drug discovery this thing. But what happened is that industry, pharma industry has not reduced their investment in the R&D. They continue to have a good growth of R&D investment in the industry, but they moved into what I would call ANDAs, abbreviated new drug applications. Several of these people have found that making quick buck by going through an ANDA route is much better than going through a new drug discovery, which involves a lot of risk and a lot of uncertainty. So that's where I think that scheme, although the scheme still exists, DSC manages the scheme and the scheme has got funds, but the kind of application that they get is not very, I would say very limited in the new drug discovery. So then what they did was that in a subsequent year in 2005 or somewhere, they have expanded the scheme in such a way, they started giving a loan component also to the industry to do themselves the research in that particular area. But why did we do this particular kind of a scheme? So if you look into the Indian drugs and pharmaceutical industry and their profit margins, no, their profit margins are always, and compared to other industries, may be very high, but it's not sufficient for them to invest good amount of money into the new drug discovery. That's one of the reasons why we wanted to bring the whole industry into the area of the new drug discovery. And I must tell you this also, I remember very well even today, when we visited several of these industries, many of them didn't know what is new drug discovery, many of the pharma industry in those days. In fact, we have to go and tell them what is the drug discovery, how it will go through and what all the issues involved into it and other things. But I must tell, the industry really quickly caught up and then they have set up wonderful facilities. In fact, in some of the cases, they have far exceeded even the CSR facilities. sometimes when I visited them, I could see that their facilities are far ahead, and they could source their manpower from internationally, and they had excellent people who had a lot of experience in drug development and other things, those who came into the picture. That's how a good base has been created. Unfortunately, we could not continue. The only industry to my knowledge was very successful in new drug discovery. Somehow nobody has mentioned about this, is that Glenmark Pharmaceuticals. Glenmark has basically came out with 3 molecules. All the 3 have been licensed with $150, $160 million like that. They have licensed it. They got their first tranche of this thing. Second also they got, but somewhere around the line, most of their molecules have been dropped or have not seen ultimately to the market. But this is a game that multinationals play. I don't want to get into that, and I don't want to go into that particular thing, but that's what happened in that particular case. But the most successful among all these things is Glenmark. Although they have a very small R&D with excellent facilities, but they have the only people. Ranbaxy also came out with, I think, one of the drug delivery molecule, I think ciprofloxacin, I think. Ciprofloxacin, they have done, and they have licensed it to outside. And also similarly, Dr. Reddy's also have one molecule which they licensed it, but they did not. All these molecules have not seen really what I would call light of the day, and did not reach to the marketplace. So while this scheme has been slowly what I would call energies have dissipated, and then slowly it has, their interests have gone. In 2000, government has announced a new scheme called New Millennium Indian Technology Leadership Initiative, and the government has said that this scheme will be operated by CSIR. So we got the scheme in our this thing. So with the learnings that we had earlier under the DPRP scheme, Drugs and Pharmaceutical Research Program scheme, whatever the learnings that we had, we built the New Millennium Indian Technology Leadership Initiative program. What we did, departure from this particular thing, in the earlier case, we expected the industry to meet their expenditure and also contribute 30% of recurring cost to the institute. In this particular scheme, we said, we will also fund you for your R&D expenditure, what you are going to do in your laboratory. So what we built the entire scheme is that R&D, industry R&D can do its R&D, but it will be funded by the NIMITLY scheme, and also academic partners who are all going to partner with them will also be funded by the NIMITLY program. And there could be more than one partner in that particular thing. And when I proposed to prepare the, what I would call is the cabinet note for this particular approval, we need to go through some procedures of the governmental, and the governmental procedures are, takes very long time. When we started doing it, that I wrote in my first note, what I said was, we will give a grant to the industry. My then boss said that, yeah, you don't understand the government. Government only knows to take money from the industry. They don't know how to give money to industry. So the government will not accept this grant business. He said, I will give you a 0% interest loan. So we put it, I have to accept to my boss. Boss is always right, you know. So I have said, okay, the 0% we have bet. When you put a 0% interest loan, the moment you say loan, the Ministry of Finance says, how can you give it 0%? My cost of borrowing money is at something like 11%. I'm talking about 2000. 11%, how can I give it 0%? It's just not possible. So when it went to the cabinet has said that no, nothing doing. That was a cabinet discussion. Fortunately, although I was at very low level in my, what I call in my cadre, I have been asked to go to the cabinet. Normally cabinets can be attended only by secretaries. And those days, whatever maybe there is, this was watched by government time. So I happened to represent CSIR with the cabinet note in that particular thing. So they did not agree. The then finance minister said, no, nothing doing, you cannot give it 0%. So then numbers are floated in the cabinet, and ultimately they said that okay, 3% simple interest. So that's how the NIMITLY scheme was the first scheme, came with 3% interest loan, simple interest loan to the industry to do their component. But one beautiful thing that we have put in that particular thing, all the failure, any project that fails, we have a write-off clause. But you give me a little more time. Okay, I'm sorry. that little more why we wanted to write off clause is that we thought it was very important, because if you are trying to do something which is far-reaching kind of an technology development and other thing, there will be failures are going to be there in that particular thing. Then what happened was CSIR, it was partly my mistake, I would call as a hindsight, and partly my successors. I left in 2009 CSIR. I did not put into what I would guidelines in putting into how do you address the write-offs. So they have never put in the guidelines. So they don't write off the loans. Now the problem is that some issues that comes into loans recovery becomes difficult and all those things. The scheme still runs. They look for good proposals. If there is somebody who is interested in really tapping into that particular scheme, they can tap into. But I must tell you one important thing in all the governmental schemes or all governmental funding, whether it is DPRP scheme, whether it is a Nimitli scheme, or whether it is BIRAC scheme, XYZ, any scheme. When you are dealing with the public money, the people, those who are dealing that particular schemes becomes responsible. If they suppose, particularly when they are giving money to industry, they are doubly accountable. Any mistake you do, they will be attribute motives to the people who are handling the scheme. So what happens is they want to be very sure that what they are doing is very transparently. So in that process, they built in what I call checks and balances in that, and the overall a program or a project evaluation, and from the day you submit the project, from the day you receive the money, it may take anywhere between 9 months to 12 months. So that's where the schemes are having the problem. I think we need to come out with mechanisms and solutions by which we would bring down that particularly funding time to say something like 3 months. Then industry would become more and more interested into getting into this particular thing. Before concluding, my interests have since then, I then moved into the Office of Principal Scientific Advisor at Delhi, and I have been from there I have actually superannuated, and then after doing that I have more got into what I would call into the incubation centers and the startups. This has become my in the off late my interest in this particular thing, and I personally feel that's what I was discussing with the day before yesterday with the director, is that each of the laboratory should consider itself as an incubation center. And each of the scientists, whoever is doing a project, must consider it like a startup. And the startup has got certain peculiar things which normally you won't find in the industries or another thing, is that they are very focused. Their risk-taking capacity is very, very high. Okay, and they are mission-oriented, like they don't deviate from anything and going into this pattern. I think when you bring that kind of enthusiasm and zeal into the organization, I don't see any difficulties for CSIR. And I would feel that CSIR today, if they are asking you to earn 30% of your budget or your requirements, I think if you are really able to do that kind of a thing, I think we will be there. Not 30%, I am sure that we will be able to earn much more. While doing this particular thing, you also should remember one thing: when Margaret Thatcher came into the power, she has closed all the publicly funded laboratories, all privatized. And if you have seen any of those things, you have an NPL here, you had an NPL in UK. All of them are replicate. Actually, there is a CBRI there in UK and the same CBRI is there here. That everywhere you will find the same names. Actually, even in the UK used to be there. All these labs have been privatized by the Margaret Thatcher. She said that is a drain on the public exchequer. I can't afford anymore. Privatize all of them. And some of them are doing really well. I don't want me to get into that kind of a situation where the government takes a decision that we will privatize all the publicly funded laboratories. Maybe we are far from that, because that has got a better history than us perhaps. I think it may take some more time, but I think we need to move into the direction of becoming slowly self-sustaining, so that we don't depend upon anybody. The only way to move into that particular thing is the startup. If not, you are going to be, the culture of, the attitude of startup should become very same. I think I will stop here. Thank you very much for listening to me.